PeaceHealth Medical Group. This training video is intended for any caregiver who administers medications at PHMG, including medical assistants, licensed practical nurses, and registered nurses. Medication administration will be referred to as med admin throughout this video. Feel free to pause the video if you would like additional time to read any of the slides. After completing this training, caregivers will be able to utilize the support tools that PeaceHealth provides to keep patients safe during medication administration. Take a moment to review the objectives. PeaceHealth is absolutely committed to creating a safe environment for MedAdmin, yet med errors still happen. We realize that no caregiver wakes up and thinks, I'm going to make a med error at work today, but here are some of the examples of errors that have happened in the ambulatory setting. Wrong med. Maybe you grabbed the wrong vial out of storage because someone put a med back in the wrong spot. Or maybe it was the wrong dose. 90% of the influenza vaccine you administer are to adults, and you accidentally gave a pediatric patient the adult dose because you were moving too quickly. Or was it the wrong time? You administered a Depo-Provera injection to a patient who was a few weeks off schedule and didn't realize it until documenting. Or maybe the wrong route. You accidentally drew up a vaccine with a syringe with a sub-Q needle for a vaccine intended as IM injection because you were preparing multiple medications at the same time. Anyone who has made a med error knows the pain of this experience at a deeply personal level, and those who have not made an error yet often feel that it is unlikely to happen to them. The bottom line is that errors occur in healthcare as well as every other complex industry that involves human beings, which is why following standard process is so important for patient safety. The evidence suggests that organizations have the greatest potential to decrease errors when they shift their focus from errors and blaming the individuals to creating a culture of safety by implementing actions to prevent errors in the first place. PeaceHealth is doing just that with our Safety Stop program. Safety Stop data has led to the creation of evidence-based MedAdmin support tools to guide this process at PHMG. This training explains how caregivers can use our PeaceHealth tools to keep patients safe during MedAdmin. The first support tool is clinical skills. PeaceHealth contracts with Elsevier to provide best practice training delivered in an online format. Clinical skills can be accessed at any computer through Crossroads. Simply search for the clinical skill you would like to review. Each module contains a variety of learning options, including text, training videos, and illustrations. The example on the screen is from the IM injection route of administration, but there's a module for each delivery route. Clinical skills focuses on patient safety and the 6 rights of medication administration, which is also the foundation of the MedAdmin policy and standard work instructions at PeaceHealth. Clinical skills are a great resource for generic best practice information that can apply in a wide variety of settings. Clinical skills is also inpatient nursing focused and has a broad application to the ambulatory setting as well. For that reason, caregivers cannot solely rely on clinical skills, which leads us to our second clinical support tool, the PHMG Medication Administration Policy and Procedure. These 2 documents provide direction on how to apply best practice within the structure of our own organization. The table of contents on this slide shows the breadth of what the policy covers. All caregivers are held accountable to comply with PeaceHealth policy. This training highlights key items from the policy, but all caregivers who administer medications are also required to read the full policy and procedure found on Crossroads. Before administration, caregivers are responsible for knowing quite a bit about the med being prescribed. Caregivers must know the precautions, safe dosage, and side effects, to name a few. PeaceHealth contracts with Lexicomp Online to provide caregivers with an up-to-date drug guide that contains all the information caregivers need to know. Lexicomp Online database is accessed in any computer through Crossroads. Additionally, once a medication has been ordered in CareConnect, the administration activity on the MAR contains a hyperlink to that specific medication in Lexicomp. Many medications also come with a package insert that should be reviewed prior to administration. Package inserts contain important information about administration techniques and monitoring. Caregivers can also check with the ordering clinician if there are any questions or call a PeaceHealth pharmacist. A best practice tip for new caregivers is to ask the clinic for a list of all the commonly administered medications. During orientation, spend time looking up each medication in Lexicomp. If the clinic does not have a list, then you can just take a look in the med prep area and find out what medications are available. Prior to MedAdmin, the ordering clinician must provide a complete medication order. Back office caregivers often pen and route orders to the clinician for signature. The clinician must review and sign the order prior to any action. The only exception is for PeaceHealth approved standing orders. Verbal orders are limited to emergent situations and are never used for the convenience of the clinician. Review slide for required prescribing information. Medications must be kept safe so that patients, the public, or unauthorized caregivers do not have access to them. That means any medication stored in patient care areas must be kept locked in the cupboard or drawer. Controlled substances must always be kept locked, even if they are away from patient care areas. Med errors can happen if there is distraction during the med prep phase. Therefore, it is integral that caregivers are not interrupted during this time. Caregivers should only prepare and administer medications for one patient at a time. Always use single-use vials when available from PeaceHealth Pharmacy, and patients receiving medications that may cause sedation must have transportation arranged prior to med-admin. The ordering clinician is responsible for providing education to the patient prior to clinic administration. However, the administering caregiver still needs to confirm patients' understanding of what med they are receiving and what side effects to watch out for. If the patient is in need of further education, it must be provided by the appropriate caregiver within scope. The MA may reinforce what the clinician has already instructed. The LPN and RN may provide the patient with additional education regarding the medication. MedAdmin follows the 6 rights, 3 checks process as outlined in Elsevier's clinical skills modules. The safety stop data is clear. Errors happen when this process is not followed. Virtually all medication errors are caught prior to reaching the patient when this process is followed 100% of the time. Let me say that again. Virtually all medication errors are caught with this process. It is important to think critically about the med being administered. If a medication is sedating or has a high risk for syncope, the patient needs to be observed until it is safe for them to leave the clinic. The length of observation depends on the med being administered and clinician direction. Must comply with state laws for medication administration. Laws in each of the 3 states that PeaceHealth operates in must be considered. For the policy to apply to all PHMG facilities, the most restrictive state legislation is used to guide PeaceHealth policy development. This slide points out specific considerations for medical assistance. I will pause for a moment and let you review. This information is also found in the policy on Crossroads. Administration of controlled substances is governed by state and federal legislation. Most clinics task nurses with controlled substance administration. Administration of controlled substances by an MA requires direct visual supervision during administration by a licensed independent practitioner or registered nurse. It is imperative that all MedAdmin is documented at the time of administration. When documentation is saved until the end of the day, there's a chance for error, such as incomplete or missing documentation, or documentation in the wrong chart. Documentation also drives billing, and the coding department will contact the administering caregiver when information is missing. CareConnect will not allow documentation edits more than 72 hours after the scheduled order. Independent dual verification is a process that can be used anytime there is a high risk for error or an error could result in the potential for significant harm to a patient. Independent dual verification requires that a second clinical caregiver independently verify the 6 rights of medication administration. This process is used for high-risk medications. See the policy for the full list. All pediatric medication orders that are based on the patient's weight and require calculation by the individual administering the medication. When the NDC number does not match the drop-down list available in CareConnect, and anytime the caregiver is concerned there might be a med discrepancy and wants a double check. The third support tool is the MedAdmin standard work instructions. This support tool provides step-by-step instructions on how to perform the 6 rights and 3 checks process in the ambulatory setting, including CareConnect workflow for documentation. We will be reviewing what this looks like directly in CareConnect at the end of the presentation. The standard work instructions are located on the PHMG education site. The workflow is also represented in the core competency for medication and vaccine administration. This competency is assigned through my learning on hire to caregivers who administer medications and is validated by a clinic mentor after a direct observation of this process. This slide talks about the differences in documenting medications and vaccines. Medications must be documented in the MAR activity in CareConnect and vaccines documented in the immunization activity. This slide shows some key differences between medications and vaccines. Regarding the NDC number, for medications, document the NDC from the vial or syringe, but for vaccines, document the NDC from the box. Regarding standing orders, PHMG has almost no standing orders for medication administration, but for vaccines, administration is completely driven by standing orders from the CDC that PeaceHealth has signed off on. However, patients who receive vaccines off schedule from the CDC schedule still require a clinician-signed order before administration. Regarding anaphylactic reactions, for medications, the clinician must sign the order for epinephrine, but for anaphylactic reactions secondary to a vaccine, there is a standing order for administering epinephrine. When applying the 6 rights in the ambulatory setting, the first check starts by visually comparing the signed med order to the med being pulled. Documentation starts at this point. Safety.stop data shows that med errors are caught when the caregiver discovers that the NDC number does not match what is available in CareConnect. In the past, this would often happen after after administration during the documentation phase. By starting the documentation prior to administration, many more errors are caught before reaching the patient. If the NDC does not match what is in CareConnect, this is a high risk for error situation. Caregivers can be so convinced that what they have in their hand is correct and the NDC in the CareConnect is wrong that it can be hard for the individual to catch the error. For this reason, if the medication's NDC number does not match the CareConnect database, caregivers must find another clinical caregiver to perform an independent dual verification, validating the correct medication has been pulled from stock. If the middle 4 digits don't match the available dropdowns in CareConnect, this is the most important. You likely have pulled the wrong medication from stock. If you both agree the medication is correct, document the validating second caregiver in the comments section in the MAR, and we will show you where that is during the review in CareConnect. Even though you start documentation during the first check, the actual site of administration is always left blank until after administration. The second check happens while preparing the med. Again, visually compare the prepared medication to the order, checking all 6 rights. Make sure any secondary container is labeled appropriately, and if the medication is in a syringe, that the correct size needle for the delivery route is in place. The third check happens in the room with the patient. At this point, the order must be pulled up on the computer screen. All documentation except for the site of administration should already be entered in the computer prior to administration. Confirm the patient's name and date of birth and allergy status, and ask the patient for a final verbal consent before proceeding. Sometimes med errors are caught at the third check when the patient speaks up and says, "That's not what I thought I was going to get." Always listen to the patient and confirm with the clinician before continuing with med admin anytime the patient has a concern. Document site of administration immediately after administration, which is easy to do since the MAR activity should be open on the screen. This concludes the PowerPoint section of this training. So next I'm going to turn it over to my coworker to show you a demo in CareConnect of our medication and vaccine administration workflow.
Thank you, and thanks for participating in this module today. The first thing I want to show you is, as we mentioned in the earlier part of the presentation, when we administer medications and vaccines, the documentation happens in 2 different places. You can see on my screen, I have an immunizations tab here, and I have a MAR tab here. The MAR stands for the Medication Administration Record, which I will refer to as MAR through the rest of the presentation. If you find that you don't have either of these tabs visible to you, you may need to go over to your More menu, hit the drop down, and star the immunization and MAR activity in this list. I have 2 orders that have already been signed. One is for a Tdap vaccine, and the other on my MAR is for vitamin B12 injection. My Tdap vaccine is an order that I can sign myself based on my standing orders. The way I review my standing orders is to go to Crossroads and go to the education website and follow the link to look at standing orders. I can also go to the CDC's website and follow their direct calendar for scheduled vaccine administration. When I'm here on my immunization tab, I can see any vaccines that have been ordered for today. Before I go in to my med prep area and begin to get this vaccine ready, my first step is to get a VIS, or a Vaccine Information Statement. This is an educational tool in patient-friendly language that I'll be handing to my patient to review while I prepare the medication. When I'm ready to begin my documentation of this vaccine, I'm going to choose Administer. Once I open this screen, I'm going to begin my first set of 6 rights. I want to make sure that the chart that I have open matches the patient that I'm preparing this vaccine for. I'm going to remove the vaccine from stock, hold the vaccine in my hand, and compare what I have in my hand to the order available to me on my CareConnect screen. Most of our med prep areas in most of our clinics have either a laptop or a computer available in the med prep area. With rare exception, if I do not have a computer available to me, I may use a printed order and take it into the med prep area to complete my 6 rights. As I look at this order, I've confirmed my patient name and my date of birth. I also need to look at this vaccine and make sure I have the right medication. This has pre-filled with me for the correct dose of 0.5 mils, the right route, intramuscular. I can validate with the CDC standing order that Tdap is indeed an intramuscular injection. I want to look at the right time and make sure that this indeed is ordered for today's date. One of the things that I need to do in checking my 6 rights for vaccines is make sure that this time or date of vaccine ordered is appropriate based on the schedule due. I also need to validate that this vaccine hasn't been given elsewhere and I just don't know about it. One of the tools built into CareConnect is the ability to query an external state-based registry. I'm going to want to do that prior to preparing this medication just to make sure that they didn't receive this Tdap at some other clinic or potentially even a pharmacy that administers vaccines. After I've completed my first set of 6 rights, including my right documentation that I have this order pulled up in front of me, I'm going to proceed with starting my documentation. The NDC lot number, or the NDC field, even though it is not a hard stop, is still required with our documentation. The first thing I'm going to do is hit the magnifying glass and choose one of the pre-entered NDC numbers that matches the box for the medication, the vaccine that I have in my hand. When I do that, CareConnect is going to automatically fill in the manufacturer that matches this NDC number. If I choose the drop down and I do not see an NDC number that matches the vaccine that I have pulled from stock, my first thing to do is double check my own work. Did I pull the right vaccine? If I did not, this is the first opportunity for me to catch my own error and make correction before it ever hits the patient. If I review the NDC number and I am confident that I have the right vaccine in my hand, however, it's not in the CareConnect database, I'm going to ask a second caregiver to look at this with me and validate that I have the correct vaccine pulled. I'll go into the comments section and I will add in here that I had a second caregiver validate. And I'm going to put in that other caregiver's 3x3. I also need to enter the lot number. and I want to check my expiration date. This lot number was automatically entered in with a defaulted expiration date of March 9th. However, the vial that I have in my hand gives me a different date. So I'm going to change this date, and I'm able to do that as needed to line up with the vaccine that I have in my hand. I can proceed to some of the rest of my documentation. I can go to the date the VIS was given. This is always going to default to today, and so I can just hit accept. I also want to indicate whether this was VFC status. VFC stands for Vaccine for Children, which is a government-sponsored statewide program that provides many of the vaccines to our clinics. The answer to this question is clinic specific, so make sure that you talk with your clinic and find out how you need to answer this for your location. There's another question here. Did the patient receive provider counseling? Many people are uncomfortable saying no to this question, but in fact, that is often the correct answer. Most of our vaccines are given without specific provider counseling. However, if a provider does spend time answering specific questions or counseling a patient or a parent or guardian, we could go ahead and put yes. Once I've done this part of my documentation, I'm prepared to do my second set of 6 rights while I get my medication or vaccine ready. Many times for our vaccines, this may be as simple as applying a needle to a pre-filled syringe or drawing up the vaccine into a syringe from a single dose vial. Anytime I move a vaccine or a medication from its original container to a secondary container or syringe, I need to put a secondary label on that. My secondary label needs to have the name of the vaccine, the dose, the date that this vaccine expires, and the initials of the person who prepared it. Although this tells me that my vaccine expires on April 7th, anytime I move a vaccine or a medication to a secondary syringe, the expiration date of that syringe changes to today. So I will make sure and put today's date on my secondary label. Once I've done my second check of my 6 rights, I've validated the right patient, I've confirmed that the vaccine that I have pulled and the syringe in my hand is indeed for Tdap. I know I've got the right dose because I see I have 0.5 mils. I'm prepared to give it intramuscularly, and I have chosen a needle that is appropriate for an intramuscular injection. I've confirmed that this is indeed due today and lines up with the schedule put out by the CDC. And the documentation so far is correct. The parts that I'm not going to complete yet are the site and the time. I will complete those once I'm in the room with the patient. I can leave my documentation now by hitting accept as incomplete. That will allow me to re-enter this portion of the patient's chart when I'm in the exam room just prior to administration. We're going to go now to the MAR and look at a similar workflow in our medication administration record. Before I go to the order that is due today, I want to take just a moment to show you one feature that many people are not aware of. I have here an administration that documents that this was just given yesterday, but I know that that was an error. 72 hours after a medication administration is documented, CareConnect allows us to go in and make edits. This is not intended to be a clinical example, but rather just to demonstrate the workflow available to us in CareConnect. If I need to make an edit to a medication that I've already given, I will go to the MAR, and again, this only works in the first 72 hours. I can click on this given bar, and it will open up the documentation that I have already completed. Down here in the lower left-hand corner, there's a button to edit administration. Once I do that, It allows me to go in and make changes to the documentation that I completed yesterday. One of the changes I might need to make is that I may have realized that this was a patient-supplied medication and I forgot to indicate that. It is very rare that we administer patient-supplied medications, but in the exception that we do, we want to make sure and check this box so that we are not responsible for the patient getting charged for the medication. The other thing I might have realized is that I signed this, but in fact, I'm not the one that administered it. It is possible, and the most frequent example might be that you are assisting one of our clinicians, and maybe you have an order for lidocaine. You've put the order in, you've started the documentation, and you've done your 6 right checks, but potentially the provider is the one that actually did the administration. In that case, all of our MAR activity has the option in the upper right-hand corner to choose document for another user. When I choose this, it gives me the option to go in here and enter the name of any clinician or caregiver that is in the CareConnect system. I'm going to leave this example and we'll go back now to the order that has been ordered for today. Here is my order for today. I have a vitamin B12 injection of 1,000 micrograms ordered as an intramuscular injection every 30 days with the next dose due today. I also have here a brief calculation that shows me if I have a concentration of 1,000 micrograms per mil, the ordered dose is 1 mil. To proceed with my documentation, I just need to click on the blue Do bar. Here I am in my MAR documentation. You can see that this does look different than the immunization tab. However, the features of what needs to be entered here and the steps and the sequence of when we do them are almost identical. I want to point out a few things. Number one, I have all of my details of the order available to me right over here. I have route, I have dosage, I have when it's due, I have the strength. And right here, this blue hyperlink, as was mentioned in the first part of the presentation, is a direct link to B12 in Lexicomp if I want to pull up more information, either for my own review or to receive patient education-based information. One of the things that's different in the MAR from the immunization activity is this action field. Right now it says given, and it will always default to given when you open your med administration order. When I am doing my first set of 6 rights, I'm going to change given to do. This will allow me to start my documentation in the med prep area and complete it in the exam room in front of the patient. As I do my first set of 6 rights, I'm going to be completing each step just as I did for my vaccines. Do I have the right patient? I'm going to check name and date of birth. Do I have the right medication, the dosage, the route, the time, and the documentation? Once I've changed this to do, I'm also going to move over here to the time and bump the time up 1 hour. By changing the time, that again allows me to start my documentation in the med prep area and finish it in the exam room in front of the patient. My next step is to look at my NDC number. Now, although on the immunization activity, we use the NDC number off of the box for our vaccines, when we're documenting a medication, we're going to use the NDC number that is directly on the vaccine or the vial or the syringe that we have in our hand. I'm going to choose an NDC number from my database. Again, just like with vaccines, if the NDC number in my hand doesn't match anything that I have available to me in the database, it may mean that I've pulled the wrong medication from stock. My first step is to check my own work and confirm that what I have in my hand is indeed vitamin B12 at a concentration of 1,000 micrograms per mil. If I am sure that I have pulled the right medication, my next step is to have a second caregiver validate with me. And just like we did in the vaccines tab, we're going to be putting a comment in if we had another caregiver validate. And we'll make sure and put in their 3x3 as well. I'm also going to enter my lot number and my expiration date. I've done my first set of 6 rights. I've started my documentation, and now I'm ready to prepare my medication and do my second set of 6 rights. Again, just like with a vaccine, if I move a medication from its original packaging and container to a secondary container, such as a syringe, I must put a secondary label on that. For medications, my secondary label needs to hold at least the name of the medication, the dose of the medication, my initials, and the expiration date. And a reminder, the expiration date of that secondary syringe is always today. If I were to take the vial that I pulled my medication out of into the room with me, I do not have to put the concentration of the medication on my secondary label. However, if I'm using a multi-dose vial, or for some other reason I cannot or do not take the vial with me to the exam room, I need to also include the concentration of the medication on my secondary label. Once my medication is completely prepared, I'm going to do my second check. I will hold my syringe or my medication in my hand, look at the label that I have, and compare it to the order that I have on the screen in front of me. Did I pull up the correct patient's chart? Do I have my right patient? Do I have my right medication? Do I have my right dose? Do I have my right route? Do I have my right time? And is my documentation correct to the point that it can be? Similar to my vaccine documentation, I am not going to put the site of my injection into my documentation until I have completed that and I'm in the exam room with the patient. I have the option with a medication administration documentation to click Accept. Care Connect is always going to bring up this red box to say, are you sure that you want to move the scheduled time of this medication? And we did this on purpose to allow for documentation, and the answer is move. Now it has closed out my documentation and process. My next step is to go into the exam room with the patient, take my vaccine and my medication with me. Once I'm in the room with the patient, you guessed it, I need to start my 6 rights again. I'm going to confirm that I have the right patient and the right date of birth. I also want to look at their allergies. Have the patient validate with me that I'm not going to be administering something that they're allergic to today. When I go to my immunizations tab and I click on administer, it will open up the activity that I started in the med prep area. It's saved all of the answers that I put in already, and all I need to do is ask the patient if they have any questions based on the VIS I gave them, and then get their verbal consent to proceed with the Tdap vaccine. Remembering that this is my last opportunity to catch a potential med error, I want to make sure that the vaccine I'm planning on giving matches with what the patient's planning on receiving. I'm going to choose the time, and it will default to right now. I'll choose accept. I've given the patient their vaccine injection, so I'm going to go ahead and put in the location. At this point, my documentation in the immunization activity is complete, so I'm going to accept. Next, I'm ready to go over to my MAR. Of note, you will often see on medication administrations this box come up. It points out to us that this order has not been verified by a pharmacist. Most of our clinics do not have a pharmacist working on site, and so you may see this. It is acceptable to continue. The great news is that the documentation I started in the med prep area is still here. Remember when we looked at the action before and it defaulted to given? We changed it to do in the med prep area. But now that I'm back in this section again, it's gone back to given, and I'm going to leave it this time because that's correct. I will go into the site, and I'm going to go ahead and document the site that I have injected this after I've done my third set of 6 writes with the patient, making sure that the medication I'm giving, in fact, is what they're expecting to receive. Looking at my dose, my route, the right time, and the right documentation as well. Once I have completed the vaccination as well as the medication administration, I've completed all of my documentation in the exam room with the patient, I can accept my documentation. Thank you for going through the medication administration documentation process with us, as well as the vaccine administration. We trust that you'll have great luck and hope that you have no med errors as you move forward into clinical practice with PeaceHealth Medical Group.